This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Mon Health Talk for this Monday. Good morning. Thanks for joining us here on WAJR. Our guest this morning is Jennifer Bender, a perinatal nurse navigator and internationally board-certified lactation consultant. And Jennifer, good morning. Thanks for joining us on Mon Health Talk.
Good morning. Thanks for having me.
What's your background? Where are you from, and what drew you to Mon Health?
I'm originally from Southern Maryland. My husband and I and our family moved to beautiful West Virginia in 2006. And I'm an associate's degree nurse with a certification in breastfeeding and also a perinatal mental health certification recently. And what drew me to this specialty, I did labor and delivery for 18 years and then transitioned into this position to support our families on their journey of parenthood from pregnancy all the way through the first year postpartum. And I've been at Mon Health for 18 of those years, just crossed over on the 4th of the month, and I absolutely love working for Mon Health.
Yeah, Mon Health, a great local institution, and obviously many fine people like yourself there helping the community here. Okay, so you've joined us this morning to talk about the P3 program. What is the P3 program? Yes,
P3 stands for Progressing Through Postpartum, and this is Mon Health's comprehensive perinatal mental health and support program. We provide education from your very first new OB appointment, sending education throughout your whole pregnancy, and also getting you additional support if you need it for mood changes related to pregnancy and postpartum. We do pre-delivery education, childbirth education, and we follow up with in-person consultations as well. So no matter how you choose to feed your baby, we are here to support your goals. We also do specialized referrals for anybody with struggles, whether it be pelvic health, physical therapy, therapy in general for the struggles of transitioning to parenthood, whether it's your first or your fifth, and also psychiatry referrals for those that have specialized needs.
Mm-hmm. Okay, so from the moment someone finds out they're pregnant all the way through delivery and postpartum care, both physically and mentally. So there, you talk about the specialization, and it looks like you've kind of headed into one of those specializations with mental health, correct?
That is correct, yeah. So on this journey to learn more about mental health, I've told lots of people this. I have 6 kids of my own and worked in labor and delivery for a really long time, and I really did not know about some of the struggles that so many of our families deal with. So when I started on this journey of doing proactive outreach for our families, I got a certification in perinatal mental health, and it has opened my eyes to struggles I just wasn't aware of. And I think a lot of us aren't aware of. So a lot of it is awareness, and also like a sensitivity that this is hard. This is not an easy journey.
Yeah, absolutely. And again, I would imagine in the past, before more of a spotlight was shown on this aspect of it, a lot of women went through it alone, right? They're thinking, oh my, there's something wrong with me. Well, there's not. There's many people that have gone through it, and there's many people like you who are trained to help people who are going through it.
Absolutely. And I've had people ask me, do you think it's worse now? I don't think it's worse now. I think just back in the past, we didn't ask women how they were doing, and everybody assumed, you'd have some changes, but everybody has a family member or a friend that they say, oh, so-and-so had a baby, and, they were just never the same again, and not in a good way. So that doesn't have to happen. There's support. I liken mood changes to diabetes. It's no different. The mood changes, hormone changes in your brain are significant for some people, and we should be supporting them.
Okay, so when it comes to postpartum, I guess it's a blanket term to say postpartum depression, but I'm sure there's many different aspects of that. How do you start to help someone who's suffering through this? I guess the first part is just ask the questions, right?
Right, that's exactly right. So we have chosen a proactive outreach model, which means we don't wait for you to figure out you have a problem. We outreach to you through a digital health platform to see how you're doing from, again, brand new OB, you just got here, you're trying to figure out how you navigate pregnancy, and then all the way through the first postpartum year. And we know that studies show us if we don't treat mood changes in the first year, they are prolonged into year 2 and 3, which impacts families and work and all of those things that are involved when mom is not doing well. So we ask meaningful questions. How is your mood? We don't just say, how you doing? Because let's be real, that's not a very good question. So this helps us. We can do remote screenings for mood and get them into our clinic to see how they're doing and get them practical help and resources.
Mm-hmm. So mom has just brought a new human being into the world that obviously relies on mom and dad and all the support system for every single thing. They rely on that for survival, but it's also important that the moms take care of themselves.
Absolutely. Self-care is really important, and it's not as glamorous as people want to say. I often ask the question, how are you sleeping? How are you eating? Because everybody assumes you're awake because the baby's awake, but often the baby's sleeping fine. Mom can't fall asleep. And let's not forget our partners, because if the birthing person is not doing well, often the partner is not doing well. So we offer support for the whole family.
Right. Okay, let's get back to the P3 program a little bit. Tell us about the background of it. What was the origin, how it began, why was it created?
Yeah, so that's a great question. In 2019, Mon Health, following the standard of care, started doing mood surveys throughout the whole pregnancy and in that early postpartum. And from that data, we found that, lots of people are not doing well. And so our family birth center nurses, our clinic nurses were all very concerned, and of course our providers. So we decided to launch a program to coordinate that care of what do we do with this data we have now. We found out people aren't doing well. Now what? So I was hired into this position as a perinatal nurse navigator to kind of find a meaningful way to follow up. And I just followed the model I learned in my breastfeeding training, which is proactive outreach, not waiting for someone to come to us. So in using that model, we've been able to do meaningful follow-up, and it's been very, very successful. We have an 85% reply rate, meaning you answer us when I send out a message over 5 years that we've been doing this now. And so our families really like it because I think it's very practical.
Okay. What about some other team members? Who helps you in this pursuit?
Yeah, so it used to be just me, and thank goodness it's not just me anymore. We have a OB coordinator, nurse navigator, Kristen, who does all the pregnancy outreach and education. She's a key component in the clinic. And then we have another perinatal nurse navigator, Kelly, who joined our team in February and doing fabulous work. So she does proactive outreach for all of our pregnant patients that are struggling with their mood to do additional check-ins and, again, referrals for resources.
Okay, so you got a team now. That always helps.
Yes, and we also have a program at Stonewall Jackson, our sister hospital. So Mindy is there, and I call her the 3-in-1 because their delivery volume is a little less than ours. So she does everything down there, and she's fantastic.
Mm-hmm. How important is the auxiliary and the Mon Health Medical Center Foundation in helping you in this pursuit? Yeah,
it's so very important. I can't stress that enough because what we do, which is fantastic and everybody loves it, is not well reimbursed by insurance. And we know we all live and die by our insurances. So most of what we do is charitably funded. And so anybody that's been touched by mood disorders in pregnancy, whether it be depression, anxiety, big mood changes, we are here to support you, and we need your support. So we had proceeds from the Ball of the Year several years, and of course that was through our COVID time. We recently had proceeds from the Golf Classic, which was really awesome and a huge, it was great. Like, we were wowed by how much people supported us, and we'll be doing some other fundraisers coming up soon.
How unique is this P3 program that you have built there with Mon Health?
Yeah, so it's the first of its kind in West Virginia, and I'll tell you, I've been to several conferences, across the country, and we are following a unique model, and other people are starting to adopt it. And so that's really cool for me to know that we're part of kind of a movement to meet people where they are rather than waiting them to figure it out.
Mm-hmm. And did I hear you say correctly that you're a mother of 6?
I am, yeah.
So you've experienced everything. I would imagine, not to get too personal, but I would think that each one of your birthing situations was probably different, right? Physically and emotionally?
Yes, and I say that often to our families that are adding another wonderful baby to their family, that every time you add a baby to your family, it changes the dynamics. So, we often attribute a lot of these mood changes to first-time families, but it's not. These changes can hit you at any time. So it could be your 5th baby, and you've never struggled with anxiety, and now you are gripped with anxiety. And so it doesn't matter how many kids you've had, these changes can happen to you.
Okay, we are with Jennifer Bender. This is Mon Health Talk. For this Monday, we're talking about progressing through postpartum, the P3 program that was launched by Mon Health back in 2019. They're in their 5th year. They're growing. Jennifer has help now. She has a staff, and they can help you. So we'll get into that when we return. What can you expect when you connect with the P3 program and some of the ways that they can help you or one of your loved ones? Again, this is Mon Health Talk for this Monday. We'll continue the conversation coming up on WHAR after this.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Mon Health Talk for this Monday. Thanks for joining us. I'm Kyle Wiggs. We're joined by Jennifer Bender, perinatal nurse navigator and internationally board certified lactation consultant with Mon Health. And we're talking about Mon Health's program, the P3 program, progressing through postpartum. And Jennifer, big part of that, obviously, is women and how they feed their new babies, whether or not to breastfeed, how long you should breastfeed. There are many ways that you can help there. So that's another area that you seem to be well-versed in. So tell us about that, approaching with a new mom, the breastfeeding process.
Yeah, so, obviously I'm very passionate about that, and no doubt human milk is the best. However, exclusive breastfeeding is not for everyone, and so we want to meet people where they are and help them meet their goals, whatever that is. So I approach feeding very balanced. It's great to have a plan, but we have to support the family. So I'm very open-minded, and I meet with people in person if they want to, and do follow-ups, and it's really helpful. But most importantly, we send out text messages through a secure platform and check in with them. So, I often say you can always reach out to me. I'm always happy to hear from you, but I will be reaching out to you because I know how hard it is with a little baby to do that.
Mm-hmm. What are some of the common problems that women and their babies face in taking on the breastfeeding aspect of it?
Just feeding in general is really challenging because, we always want babies to feed on a schedule, but they don't like that. They don't do that. So just trying to balance how often they should be eating and meeting your personal needs too, like sleeping, eating, showering. And learning to accept support. You very much want to do it all yourself when you have a new baby, but you need support. So helping people and getting the support they need and knowing it is okay to need support.
Right. This program seems like it's all about support. So if someone out there is listening, maybe someone just found out that they were going to have a baby, their family was going to grow, and they believe that what they've heard here, this P3 program, can help. How would you encourage them to get involved in this and contact you?
Yeah, so they contact Mon Health to schedule their appointment, and we'll get them in, and we enroll them into P3 program with their consent, because we know 1 in 5 mothers and 1 in 10 partners struggles with their mood. What they can expect is a virtual visit with Kristen or Mindy in the office, and then we follow up the whole time. We send messages out to you. And we start educating you and your family about the symptoms of mood changes that are more than average. So that can look like sadness, anger, exhaustion, like no motivation. Trouble sleeping is probably the biggest hallmark, and the lack of sleep is just very cumulative. So we've got to treat that.
Mm-hmm. So you've been doing this for 5 years, and you've helped a lot of people. You've helped a lot of women and their partners and their children. How important is that on their side to know there's somebody out there that cares about me and that can help me?
Yeah, I mean, honestly, I tell people, like, this is the best job ever, because I get so many messages back from families that just are, like, I know it touches them. And I often close a lot of my messages with, "You're doing a great job." And I know that seems like, oh, yeah, how do you know how I'm doing? I know you're doing a good job, because parenting's hard. And we, as parents, beat ourselves up so much about that we're not meeting the mark. If the baby's fussy, it's our fault. Well, we didn't wrap them right, we didn't pat them right, we didn't burp them right, and it's just not like that. So I get lots of feedback from families that just send me hearts and crying emojis and like, I needed to hear that today, and we all need to hear that. So I love to be an encourager and also give solid information from well-reviewed sources, and just be a support that they are doing a good job and we're here to support them.
So how can people get in touch with you? How can they get started with this?
Yeah, the best way to do that, you can go to our website. You can, again, call our office. Once you're enrolled, then we'll be proactively messaging you. I also receive referrals from other sources, from several of our pediatricians. Families have self-referred and said, hey, I'm concerned about my family member. And once I get their permission, then we start our interaction. So we will support anybody, because we just want everybody to get that support.
Mm-hmm. So you've built a foundation here. You have all of this cumulative information, both with helping people, and I would imagine there's a science to a lot of this. So it's probably important to get started right when you find out you're going to have a baby, right? Get ahead of it?
Yes, it's very important to get educated. And yes, there's lots of data behind this that proactive outreach helps. With mental health struggles, there's lots of studies about duration and initiation of breastfeeding, and also cessation of smoking and other substances, that having that proactive support. So, yeah, just give us a call and we'll get you enrolled, and we'll be here to support you.
Okay, last thing here. We talked about the support you get from the auxiliary and from the Medical Center Foundation. What about if somebody's out there listening and this is a cause that's near and dear to them and they'd like to help, or maybe someone who's been a former patient that was helped a great deal by you, and they'd like to provide a little bit of financial support?
Yeah, we would really appreciate that. So they can donate directly at our website. There's a Donate Now button. There's also a QR code. They can always donate through the foundation. Just designate your gift to P3. And we will also be doing a tailgate at our Mon Health parking lot the 13th, this coming Saturday, for the Pitt and WVU game, and we would love to have you come by. We're giving out water, and we'll have our QR code, super easy for you to donate, because we need all the support we can get.
All right, so a tailgate for the Backyard Brawl. That sounds like a lot of fun.
Yeah, we're very excited.
What time does that start?
So we're going to be at the parking lot 8 a.m. till kickoff time. I think it's still
3:30. Yeah, 3:30.
Okay, all right. So we'll be there through kickoff, because we know after kickoff, everybody's done.
Yeah, everybody's.
But we're super excited, and we appreciate everybody's support.
All right, very good. So 8 a.m. there for the tailgate.
That's right.
At the Mon Health facility. Well, Jennifer, this was great information. We appreciate your time, and good luck. Thanks for everything you do.
Thanks so much, Kyle. Appreciate you.
All right, Jennifer Bender there. Perinatal nurse navigator, internationally board certified lactation consultant for Mon Health, talking about the P3 program. And that's Mon Health Talk for this Monday on WAJR.